Welcome to the Brendan G podcast, folks. My name is Brendan, and we're going to be tackling a subject that you probably either at some point in your life have dealt with as a problem, or you know somebody who has this issue. We're going to be unlocking better sleep. I am joined today by my co-host, Dr. Jason Dubois. Jason, what's up? How you doing?
Good to be here. I'm excited about this topic today.
So today we've got Dr. Zeke Medina. He is the sleep specialist. Okay, he's a certified pharmacist and sleep consultant with over 15 years of experience. He's the founder of Live, Love, Sleep. He's been helping people improve their sleep and overall health through holistic approaches, reducing dependence on medications and focusing on what's really causing those sleepless nights. He's also a faculty member at TheraOptimal Health, sharing his experience worldwide and mentoring future sleep consultants. Welcome, Dr. Zeke. Appreciate you coming.
Hey, Brendan, thanks for having me. And Dr. Jason, it's good to see you in person, almost virtually. Just a great feeling to be here, guys. Thanks for having me.
I'm going to throw the first question over to Jason.
I have to ask, as pharmacist to pharmacist, I know my path started out in classic pharmacy school, and now I'm, I have my own supplement company and doing what my passion is all about. I want to hear about your story because, that's not a traditional path to go from pharmacy school pharmacist. Like when we think about pharmacists, we think of traditional drugstore behind the counter thing.
Yeah.
Tell me the story. How'd you get from that to where you are today?
I started out in retail pharmacy and traditional pharmacy. So I worked with many clients, many patients that were hypertensive. They had cardiovascular disease, diabetes, high cholesterol, all the gamut. These were the people typically getting sicker and sicker. And one thing that just caught my mind because I had struggled with sleep issues since I was 15. I mean, it just was always a part of me. I was on sleep medication. I was on attention deficit disorder medication because I couldn't pay attention. I couldn't, concentrate during the day. I thought this was the normal life for me. And if you ever talk to anybody in functional medicine and you ask them, why did you get into functional medicine? Most of the time, the answer is because it happened to me and the whole world just exposed itself on root cause. And around that time, I started dabbling because my daughter was born and she did not sleep either. And I was thinking to myself, this is all genetic. I remember my dad from a very young age, starting all the latest and greatest sleeping pills, nothing was working. Tried alcohol, nothing was working. And it just caused him to get heavier and heavier and more unhealthy. And it just became a problem. And I just knew somewhere in my future, that was me. Right. So what ended up happening was we ended up getting our daughter sleeping. And I was just amazed. So I started digging into the research, looking at circadian health, looking at how to optimize my sleep pressure, what kind of stressors can really impact your sleep. And that's when I started to solve my sleep. And then just about that time, my wife's mentor, because she was doing the pediatric sleep consulting, my wife's mentor started teaching adults. And I said, well, what do I have to lose? Might as well just kind of get her philosophy and combine that with my medical pharmacy degree. And guess what? I can start doing this on my own. And at that time, I was working for a healthcare organization and I was just looking at patient profiles and talking to patients. And I started to notice with every chronic disease that I handle, there's always seems to be a sleep medication, trazodone, Ambien, some kind of benzodiazepine. And I started wondering, let me just ask these guys, is this helping you? Is it working? Do you get a full restful night's sleep? Do you feel energetic? Do you feel this? And many of them was always no, nope, this doesn't help me, but I can't do anything else. And just the mere fact of just teaching them a little bit about sleep hygiene was an epiphany. They had never heard of any of this before. And so I started thinking maybe more individuals need to know this. And so I started going into business myself. Me and my wife started to team up. And when we had a parent that had a baby with sleep issues, I would say 25% of the time, parents also had that. So it just became like a tag team of us, just kind of helping the whole family get better. And oftentimes it wasn't just like the mom or the dad, it was both because they were both interested. And they were just shocked that a lot of it was metabolically related. when it came to stressors. So it's been an overall health journey for a lot of my clients.
So when did you start like doing this? I mean, are you doing this full time? And like, when did you really start to focus in on it?
Yeah, I would say this is since 2016. I've been doing it more in the 2020 era, as you can imagine.
Mm.
Everything went virtual. So it was just kind of like that was probably my biggest year. And then at that point, I started getting approached by certain companies, certain institutions talking about how do we spread this out to more people? And so now I do very little with one-on-one, and I'm doing more of like, how do I create courses for people? How do I impact that larger audience that typically don't need a private coach, but they just need the information because they can do the rest themselves. And there's seems to be a vast amount of people that can do that. They just need the information and how to work through their sleep issue. So that's kind of what we're working on with a couple different institutions that I'm working with right now.
Fascinating. That's fascinating because I think as a pharmacist, when I went into pharmacy school, I had a notion of what I was going to be doing, you know, that I was going to be working in retail or hospital. And there was a few other avenues when I was going through pharmacy school, different directions I could take, but never in my imagination at that point in time did I think that I would transition over to natural health and helping people with natural remedies. And I love your story. I love how you're taking something that is near and dear to you, something that's important to you and your family, and then helping other people and making a business out of it. And it's a wonderful thing. So
I appreciate that, Dr. Jason. And, it's funny because, as a pharmacist, when we're going to pharmacy school, we're giving all these options and we're thinking to ourselves, like, this is the cure, or at least the cure to the symptoms that
yes.
we need these members on. And it's up to us to educate them on side effects, what they can expect, and all these other things, drug interactions, which I don't know any medication other than water and air. I wouldn't even call it that has no drug interaction. And so a lot of times I end up finding myself that the big thing is that there's so much information out there. There's so many influencers saying if you're on sleep medications, that's bad for your health. It has all these side effects. So I end up finding a lot of these clients because they want to get off a medication. And a lot of times when you look at long acting or long-term benzodiazepine use, there's no one better equipped than a pharmacist,
Mm.
that knows the side effects, knows how to titrate, knows how to see those, withdrawal effects and say, hey, go back to your higher dose until your body gets used to it. And then we can slowly start to taper. And I feel like a lot of the titration methods out there for a lot of these sleeping pills are extremely fast for a lot of people. And
Mm.
for a lot of my older clients, they need that 1 year titration, which seems extraordinarily high, but that's sometimes what we need to avoid all that.
I think that I want to explore that a little bit more because I think a lot of folks that are struggling with sleep and they are on the benzodiazepine pathway,
Yeah.
um, and it's kind of working for them, so to speak, but deep down there's a desire to get off of that medicine because it's not without side effects.
Mhm.
And I want to explore that just for a moment. I'm going to kind of steal the show here from Brendan for a second. And I want to
Go
explore,
right ahead.
I want to explore this notion of a long taper because I really hadn't thought of it, to be honest with you. Like, and I
Mhm.
don't know how to counsel a patient on how to get them off the benzos because it's very difficult. I find it very difficult.
Yeah.
So, high level overview, like
Sure.
you're tapering someone off. Like, what are the principles to doing that
Yes.
successfully?
So let's talk about, just a 20, 30-year-old, because this is gonna be very, if you have a patient 50 years and older. Now, Medicare will say 65 years and older, you shouldn't start them on certain benzos because
Hmm.
they have long-acting metabolites, for example, diazepam. However, for someone my age, 40 years old, I'm going to say if they were on something like alprazolam, which is generic for Xanax. Now, this medication hits you fast and it shuts off really fast. causing you to be more withdrawal, quicker, wanting that next dose. And that's why you'll see a lot of prescriptions 2 or 3 times a day, or it's extended release.
Hmm.
Now, if I am lowering a dose on alprazolam or Xanax, I'm most likely not going to have the success that I do with a longer acting benzodiazepine. So I might get one of those equivalent charts of benzodiazepines and say, what is the equivalent dose from Xanax to diazepam or generic Valium? Because I know that diazepam has a much longer half-life. So if a patient
Ooh.
misses a dose, then a lot of times it's going to take a long time for that drug to completely come off. And therefore, it's not going to have that big withdrawal effect. I think that's a lot of parts where people don't want that rebound insomnia because they are so traumatized by, they have this anxiety around sleep. One of the biggest perpetuating factors when dealing with insomnia is that they are anxious about not getting a good night's sleep. They know they're
Yeah.
going to feel bad. So there's a lot of prepping that goes along with these types of clients where they might feel like once I start tapering off, like, I don't think I can do this. And it really is just rewiring, reframing their negative thoughts and then allowing them to understand you're having this anxiety. It's normal, right? And as we taper off slowly, we're changing these medications just so we can, get you off much more gentle. And
Mm.
then we're also looking at metabolic. How are they metabolically? Like, do they have a good diet? Do they have an exercise plan? Are they going out in the sun? Are they practicing a more holistic lifestyle? Because if they aren't at their strongest when they taper off, and let's say they just got over something, they have bad allergies, their immune system's, wrecked. You taper off of something when your body's already stressed.
Yeah.
Well, guess what? You're just adding more stress to it and you're not going to be successful. So educating our patients about how we can beef them up. And sometimes it will take 3 months before I start to taper off. And with that, I'm getting their doctor involved at this point. I'm showing them my taper prescriptions. And typically I like diazepam because it is liquid form,
Yeah.
even though there's a bunch of junk in there that, of course, I would not give to my kids because of the color dye and preservatives and all this. When we're just clearly looking at the active ingredient, I am showing them that we can taper this slow by slow. And we can do it faster if you like. But once we start to see those side effects, we're going to go back up because I want you to feel comfortable. I want you to feel confident throughout this whole process. And that way you feel better. And I've just found that to be way more successful. Um, Even though it takes so much longer. I think a lot of people appreciate just having that person that they can text,
Yeah.
and get an answer right then and there. So it's just been a much more eye-opening experience as I start to work with people more and more with benzo withdrawal, and just tapering off of those.
I got a quick question for you. So you mentioned sleep hygiene. Could you like describe what you mean by sleep hygiene?
Yeah. I think you might have heard the analogy of, oral hygiene, right?
Yeah.
You can have great oral hygiene, which is brushing your teeth, flossing your teeth. However, if there's underlying things that you're not working on, you can still get cavities. So
Hmm.
same thing with sleep hygiene. You can have that taken care of, but there's underlying causes of insomnia that can still be there and cause you to sleep. So it is not the end all be all for sleep improvement, but it is a part and it's an important part, just like brushing your teeth and flossing your teeth. So when I talk to somebody about sleep hygiene, a lot of what I teach in the 4 pillars of just kind of how I tackle a sleep issue, let's talk about circadian rhythm health, right? How do we anchor your circadian rhythm to the time of day that you want to be awake and asleep, right? A lot of that sleep hygiene starts to come into play. So you might hear the rule or a sleep hygiene tip, don't eat 3 hours before bedtime. Don't work out 3 hours before bedtime.
Right.
Potentially stop drinking water 2 hours before bedtime if you find yourself going to the bathroom. Make sure you start dimming down the light 1 hour before bedtime. Be careful with blue lights. Maybe put on those blue light blocking glasses if you're afraid like your mom's gonna walk in and just bam hit the bright light because she can't see and now you're messed up. So it's really just rules that really support those other things in sleep, but most of the time they don't address the underlying causes, which can be precipitating factors, perpetuating factors, or even those predisposing factors like anxiety or depression or PTSD or some kind of trauma. So sleep hygiene, so important. You still want to practice the best sleep hygiene that you can practice, but most of the time with insomnia, it's not going to be the end all be all cure for those types of things.
Right, that makes sense. What you talked about the benzos earlier. I mean, those are usually antidepressants, right? But in this case,
Anti-anxiety. Yeah.
anti-anxiety. Thank you. And could
Yeah.
you tell me what the difference between anti-anxiety and antidepressant is, and then maybe some of the cons that people will experience when they're not tapered properly?
Yeah. So typically, when you're giving an anti-anxiety medication like a benzodiazepine, typical guidelines will state that you should be also given a chronic medication or maintenance medication, which is sometimes an SSRI or a different type of typically what's been known as an antidepressant, like sertraline or Zoloft, escitalopram, all those things. Now, those types of medications, the SSRIs, can take up to a month to start to show effect and help with anxiety.
Yeah.
Also, they work with depression as well. They're kind of in a similar mechanism. But what most doctors will do is prescribe a benzo. So if you had any type of panic attack, and here's something that your pharmacist should be telling you when they see an SSRI antidepressant along with a benzo is that when you start your SSRI, you might experience more panic, more anxious, more, just kind of at edge, side effects as that SSRI starts to kind of melt into your system and just kind of, do its thing. So that's what the benzo's for. When you have these anxious attacks, you can take the benzo, kind of mellow out. But typically, those benzodiazepines should not be taken longer than 2 weeks. What typically happens is this SSRI doesn't do anything. Toss that. I'm only going to take this benzo because I feel better.
Yeah.
And there's not that transition in care that says this is the education piece that all your patients need and doesn't get hit. So a lot of times people are on this and they find out, oh, well, I kind of feel really sedated when I'm going to bed, so I'm going to use it for sleep. But just what the body does the best, it likes to adapt to things and you build a tolerance. That dose ends up getting higher. And when it does, it's still helping you sleep, but now we might see side effects. Now you might want to enjoy some alcohol and completely forget what happened that night. And your wife comes to you and be like, you were an ass last night. What happened? Oh, well, I took a benzo. I was on alcohol. I stayed up late past my bedtime. All these stressors and medications that are really interacting. And that's why people tell me, I'd like to enjoy alcohol. I'd like to be with my friends and do this. But I realize when I take my benzo, I am a mess. I don't remember anything. And I was like, yeah, that's a big side effect. It's a really big side effect is that amnesia. That's actually, there's a different type of chemical that's the actual, what they call roofie, right? And that's a very potent benzodiazepine. So it's very common to see stuff like that.
No,
I
So let me,
digress though.
let me ask you two separate questions. So in follow-up to that, what do you say to the person watching the video now that is about to go down this path of needing a medication? What do you say to that person right now if you were to interview them, be like, hey, let me help you course correct before you get on the benzo? What do you say to that person? And then conversely, what do you say to the person that has been on a benzo or a sleep aid, and is kind of like addicted to it and wants to get off, so to speak? So two different people. What are you telling them at that point in the journey?
So let's talk about the second one because that's the question I remember the best right now. So, um, so somebody's on it. They've been on it forever. I mean, this is my clientele right here. And it all starts with education. What I've seen, what's been in the literature, what's out there, how we can taper. But before we even do a taper, I'm taking a detailed history on their battle with this sleep issue. And most of the time, I see that they are very educated, but they just don't know about this one topic. And that's what they need. I had one lady, she didn't care any of my sleep advice. She just wanted to have someone hold her hand through this long taper, right? And I said, okay. And we came into a point where we had a shortage on diazepam in her area. And she was like, I don't know what to do. I have pills. I don't know what to do with these pills. And I go, all right, we're going to do something off the record. I don't want you repeating this to anybody, but we're going to do some water taper. And it's basically like a customized compound in water, breaking things off, and just kind of making her, you know, daily samples of her medication just to get her by until we were able to get that back. I don't recommend that for anyone to do, but there's YouTube videos of people doing it. And, working with a pharmacist or somebody that knows what they're doing, it's great. But you're starting with the education. They have to know what is going to happen in that first week, in that first month, in that first 3 months, so they can at least be prepared. And they have to also know that we can't predict how you're going to be as we get off of this, right? It's all going to be just extremely customized, and we might have to pivot. So I've had people that are like, I want to decrease 10% every week. And I'm like, well, that's fast. I know guidelines say that's slow, but that could be fast for you because you've been on this benzo for 2 years or longer. And so a lot of that is just preparing them, right? Now, for your first question, I think it was somebody that's about to start a sleep medication of any kind, and they just kind of want that. So this happened to me last week. Somebody goes, hey, Zeke, I know you're a pharmacist. My doctor just prescribed this medication. It's trazodone, and he gave it to me 2 tablets once a night, and it seems to be helping. And it was end up like trazodone 100 milligrams. And so I quickly told him, what is your goal for sleeping? Like, is it to take this medicine and be okay with it? Because if so, there's nothing wrong with that. Okay. I want you to feel comfortable. I don't want to guilt anybody and be like, oh, sleep medication, you don't need that, blah, blah, blah. I could do that all day. I'd be busy. But I want to make sure that if somebody's in the right mind to accept advice from someone that's a little bit more holistic, I want to get that by knowing what their goals are. And if they say something like, I hate to be dependent on this because if I can't get a hold of it, that really freaks me out. I was like, well, first of all, don't freak out. Trazodone's everywhere. You won't run out. Like, that's perfectly fine. But if you're ever wanting more advice on just overall holistically how to be healthier, because a lot of times I strongly feel that as we get older, our bodies will tell us when we're stressed. Either our blood pressure shoots up, our heart rate shoots up, or we start to have sleep disturbances. And typically around that time, it's important to try to investigate to see if there is a root cause. And if we can find that, and oftentimes it's metabolic related, that happens to be the perfect time to make that intervention. And the individual I was talking to, I mean, my red flags were just going off like, oh my gosh, there's definitely some insulin resistance going on. There's visceral fat and overabundance of belly fat. So we're definitely dealing with inflammation, low grade inflammation. But you can't tell anybody that when they're just asking you about a pill, So you got to really see what their goals are first, and whether or not they're receptive of this type of device, this type of information. Otherwise, if they just want pharmacy information, I can give that all day. I mean, that's easy.
Would you say most people are doing wrong when it comes to getting quality sleep? I think we all want it. We don't eat it. And what would you say is the number one thing that people just need to change and to get that quality?
You look at, because it seems like if you look up circadian rhythm, a lot of people can get some really good keywords, but we seem to like not get the full picture. Because when you look at circadian rhythm, you're told about schedule, wake up, sleep time, got it, right? You're told about light, basically no bright light at night. But are you really told about, like, look at the light that you guys are in, look at the light that I'm in. There's about 500 lux of light in our area, probably lower. Okay. Outside right now, at least in Texas, it's probably over 100,000 lux of light. That is the type of light that we evolved from as humans. That's what we need as an anchor in our circadian rhythm to anchor our times. We need this sunlight. So many of us have a light deficiency because we work indoors under fluorescent toxic light. I mean, that's just crappy light for you in general. And we don't work near windows, or we don't go outside and eat and walk around and move. And that's the other thing about circadian rhythm. Movement is important. You have to find movement all throughout the day, not just one time in the day where you do a workout, maybe a walk here and there, and then that's it. Like, you have to have movement throughout the day. So the circadian rhythm in your muscle can start sending that signal back to the circadian rhythm in your brain, and you can get on this schedule. And then lastly, when it comes to circadian rhythm, is time restricted eating. Your digestive system, they're all linked with the circadian rhythm, which means when you eat, everything is talking to itself. And when you stop eating for the day, typically 3 hours before your bedtime, now your digestive system can repair itself. It can produce new cells. It can completely take away old, disgusting cells, put it in the stool, and you can regenerate. And that's why people will talk about time restricted eating, because there should be a time where you start eating and stop eating, and then you don't go further. That's why it's been so toxic and metabolic unhealthy to extend your eating time past 3 hours before bedtime, because you're revving up this machine, which causes and generates heat, and your body can't even cool down to go to sleep because everything's starting to work. It's like it's 10:59. You're about to close down the restaurant, and you get that one customer that comes in. Now you got to start everything up because they want appetizers, they want an entree, they want dessert, and you're over here going, "Damn, I was really hoping I'd go home right now." But you done opened the kitchen because you decided to drink some alcohol, and now everything has to get back up. So if you ever wonder why your body gives you a little acid reflux from time to time when you eat late, that's because everything was shut down and you done upset the kitchen. So find that 3 hour before bedtime window, stick to that, and you're not only going to be like benefiting your circadian rhythm, but you're also going to be benefiting your digestive system, which is probably one of the best things we can do for our bodies.
That is a great analogy. I love that.
Yeah.
Okay, so
Yeah.
I
here's
don't know who I stole it from, so
that's it's yours now, Zeke. All
yeah.
right, so I got a question for you. So based upon that, are we talking about intermittent fasting, or are we talking about, look, let's just stop eating after say 6:30 and go to bed? Like, what does that thing look like for most folks?
Almost the same thing. I mean, you could do some intermittent fasting for most men that aren't stressed when they hold on to their calories, meaning if they go 12, 14 hours, if they don't feel like, oh man, I'm about to die because I'm hungry. Most men can do that. I say that because when women, especially women that are still menstruating, they have different cycles in their process, where if they fast on a certain phase, it can really stress out their body when they need those calories.
Sure.
But one thing about time restricted eating, it's just a 12-hour eating break. So most people can do this, meaning they can stop eating at 8 p.m., pick it back up at 8 a.m., right? Especially if you're going to go to bed 3 hours after you stop eating. I mean, if you are still hungry, there's probably a big chance that you are eating things that are really disrupting your blood sugar, and you're getting these fluctuations, and we need to check on that. And that's one of my favorite parts, is playing investigator to see, like, all right, where am I getting these spikes? Because you should be hungry. All right, we need more protein, more vegetables, more healthy fats. I'm going to fill you up 3 hours before bedtime. You're not even going to think about wanting to snack. So really, time restrictive eating, it falls under the lines of what you can consider intermittent fasting, but it's really just having that 12-hour break for your digestive system, which also does so many good things with with your sleep. So a lot of research around time restrictive eating that way.
Okay, that makes sense. So you talked about cortisol, and we talked about
Yeah.
metabolic syndrome. And obviously, when people think about sleep, they think about melatonin. And so, like, we might as well throw serotonin in there too, because you're talking about gut health. Like, how are these things, when you take a look at a person, how do you read things and how all these things balance each other? What are you trying to
Yeah.
drive?
One thing that I always ask my clients, and I'll take a 6-day food and beverage log just to see kind of like, what are you eating? And I would definitely say for a lot of vegetarians, nothing wrong being vegetarian or vegan. I know they're a strong group and they'll completely destroy me. But when it, when
The
it comes
cancel
to it,
culture.
yeah. When it comes to it though, I'm looking to see, do you have adequate protein? Are we able to get things like tryptophan and good and
Right.
healthy carbohydrates, right? Because when we look at tryptophan, we're going to need insulin to push it through the blood-brain barrier. Because what does tryptophan convert to with all the reactions going on? Converts to serotonin. And with more reactions and enzymes, serotonin goes into melatonin.
Mm-hmm.
So, first of all, are we supplying our bodies with the much needed building blocks that we can consume, right? So, I'm looking at protein, and most of the time it will barrel down to beef being a great one, organ meat, if they can tolerate that.
Right.
I'll even talk about little ways to kind of slither some organ meats into your ground beef, put some taco seasoning, and you really can't taste it now, right? But you're eating a nutrient dense, packed protein meal that you're now feeding your body, right? There's obviously B vitamins that are important, right? Vitamin B6, B3, B12, B9, they all impact that. Magnesium plays a huge role when it
Right.
comes to converting. I mean, what is it now, Dr. Jason? Like over 300 enzymatic reactions that magnesium is
Yeah.
involved, probably
Yeah.
more. And then, of course, vitamin D3. A lot of my people on Instagram are like, aren't you afraid of skin cancer? I'll just take off my shirt in the middle of the day and I'm outside for a 30-minute walk.
Right.
I do it every day. I don't do it, by taking a break for 3 months and then I go out for an hour and I get burned. I'm doing things in moderation. So I'm looking at to see how my skin deals with that, but I'm getting the most bioavailable vitamin D. All of these minerals we can get from our environment. Magnesium might be a challenge because our soil is completely depleted of topsoil nutrients, minerals, fungi, things that really allow the plants to be more nourished. So I might supplement magnesium, but hey, that's kind of nice because I can use magnesium in the form of bisglycinate to
Hmm.
help, trigger some relaxation. So melatonin, always important. We can do it through our food if we're real cognizant of how it's produced. But there's also melatonin tests that you can do. They'll typically have you spit in a tube, and typically right before bedtime. And I'll tell most of my clients, if you're going to do this, make sure to follow a nice power down routine to really allow your body to start to produce that melatonin, so you can see the peak of what your melatonin production is. And by doing it that way, you can see if you need any supplement or not. And just in general, I do find that women typically don't need as much melatonin as men. But if you're using it strictly for sleep, I would definitely say like 1 to 3 milligrams. Anything over that, we're probably overpowering, how much you actually really need for sleep based on what your body typically produces at night. Um, but I'm sure we can get research article out of research article that says 30 to 60 to 100 milligrams of melatonin is good as an antioxidant, as an anti-cancer agent. But I mean, we're just looking at sleep here. I mean, you shouldn't need that much melatonin just to sedate yourself. I think nature has a much better way of producing sedatives in your body. We just have to be a better vesicle to recognize those by, implementing those stress-free zones right before bedtime, so we can start to go, oh my gosh, my body is tired, instead of putting ourselves in front of a computer or social media that distracts you from your natural sedative.
I've seen a terrible trend in melatonin use at the health food stores. So I spend a lot of time in health food stores, obviously, and I research a lot of different formulations. And I know at one point, Dr. Zeke, I was talking to you about what ingredients would make up a good sleep formula. But on the shelves today, I've seen us go from a melatonin dose of like half a milligram or a milligram up to 3 milligrams. And now it's even way beyond that. So I'll go into a store and I'll see a single product ingredient having melatonin of 6 milligrams or even 10 milligrams.
Yeah.
And it's just too much. Like,
Yeah.
if you, this is me now talking, like if you are someone that is relying on that much melatonin, then there's something really wrong.
Mm-hmm.
There are other supplements, there are other techniques, there are other things that you could be doing to get better sleep. And it's almost, you're basically inhibiting your own body's ability to make endogenous melatonin when you're giving it as an outside source. So I know people like it. For me, it's toward the bottom of sleep supplements, in my opinion. But I'm just seeing a lot of people rely on it. I don't know where it's coming from, but I feel a lot of people use it too much.
Yeah, and I think it's also the type of company you're getting it from. You go to really health food stores where you see a lot of great brands out there that test their supplements, making sure that if they put 3 milligrams, it has 3 milligrams.
Mm-hmm.
But then we also go to other stores, and I'm going to just list them out like Costco, Walmart, Walgreens, CVS. I mean, they cater towards a market where people are looking for deals, and you'll see, a 3 milligram melatonin buy, one get three free kind of thing, and that kind of is scary because if there is that much margin to get from this, right?
Mm-hmm.
What kind of quality control or quality assurance are they doing when it comes to producing that supplement? And there was some research, a while back that talked about how they took a 3 milligram, supplement, and they saw that it had, a fraction of the actual dose to 300 times that dose. And when kids are using this, which is kind of scary, we have seen in animal models, there's research in animal models that shows that it, stops or slows down that puberty growth. And so if you're giving it to an adolescent, please make sure you're working with a doctor or somebody that knows what to look for when it comes to growth charts and things like that. But also you're getting a professional grade supplement that has that exact dose in there. And I think that's probably one of the things that when parents hear this, like, oh, melatonin, that's harmless. It's not. It is a hormone that in animal models, we have seen a decrease or an inhibition of puberty. And for the growth of, most people, that's going to bother a lot of people. So just make sure you're working with your doctor and they know what to look for.
Okay, that's really important. Like I gotta jump in here for a second. That never even occurred to me. So,
Yeah.
as somebody who spent a lot of time on the raw material side as a manufacturer too, I always tell people, look, you get what you pay for. But I hadn't figured that people might be getting an overdose of the active ingredient when they go inexpensive. I mean, I understand that there's a complete lack of quality sometimes in some of these
Yeah.
more less expensive supplements, but that did not even occur to me. That's huge.
Yeah. Yeah.
And of course, you're right. It's a hormone.
I know it's like some people just think, oh, it's a supplement, it's like, magnesium. The worst it's going to cause is a little bit of diarrhea in the morning or something. But I'm like, no, man, melatonin, it can start to really mess things. And like Dr. Jason was talking about, like you don't want it to desensitize your receptors where you can't produce it yourself when you get off of it. And that's what kind of leads
Absolutely.
to that rebound insomnia as well. So it's like,
Mm-hmm.
we'll sometimes have to, I'm cautious about everything. I'm going to tell everybody if we're going to take a supplement off, I'm going to have you slowly take it off. A lot of my clients are like, man, I just took it off and I'm fine. I'm like, all right, well, I get cool now. I mean, that's great, but I told you this is what I wanted to do. And, so sometimes you just get that, like you got these gung ho people and they're like, you tell me I'm going to do it. And I'm like, well, I said slowly, but I guess you didn't get that part. So
That's a great point. So for people who are looking first to solve some of their sleep issues, and I can tell you, my wife was having sleep issues just this past week, and she was like, "I took 3,000 milligrams of magnesium, and I slept like a baby." So it's almost impossible. Well, I won't say it's impossible. It was really difficult to overdose on magnesium or like vitamin C or vitamin D. But you make a great point. Anything that is a hormone like melatonin, that is something that you really should not be playing with. So that was great that you brought that up.
Can I ask a controversial question, Dr. Z?
yeah, is it going to get me canceled?
Mike can't the us first, but go ahead.
All right. So I
Better not
want,
be about politics.
but I do want your professional opinion on some of these like sleep aids that I see, and talking about like the nasal strips and the mouth tape. Is this hype or is it legit? Like, what's your take as an expert?
That's a great question. I'm so glad you asked that because I recommend a lot of these. Um, the one thing I would say is if you are at risk, first of all, if you are at risk of potentially being sleep apneic, so if your wife or your spouse or somebody has told you, man, you snore horrible, or
Mhm.
sometimes you gas, or sometimes you stop snoring and then you make this choking sound, or sometimes you'll snore and then I stop for a while and I don't know what's going on. If you hear any of this, go get a sleep study. Like they have so many sleep study devices now out there. You can go to like a hotel type of sleep study where they can, hook you up and make sure that, you're having sleep apneic events. It's caused by either central sleep apnea or it's an obstructive sleep apnea. Central is just like the brain shutting the airflow out and, you just can't breathe. And you have multiple events per night. Obstructive is like maybe you have some weight into your neck, or you have swollen adenoids that is causing your breathing to shut off. And a lot of times it's because people are mouth breathers just by trait. If you find yourself constantly inhaling, breathing through your mouth, well, you're constantly putting a lot of or holding on to a lot of CO2 because air and oxygen is going in and out so fast that you don't have that ability to change out the CO2. And that's why nasal breathing is so far superior than any time you're going to do mouth breathing. Mouth breathing is like your fifth gear in your car and you're working out and you need that oxygen right there, right? That's like your last gear. But I feel like for the majority of the time, we should all be nasal breathing. And this is where I get into the point. If you cannot nasal breathe, we need to find the root cause. Going through, you mentioned nasal strips. I am a avid user of opening up those nostrils. Like I am trying to get more oxygen in. And a lot of times your sinus, your maxillary sinuses are right here. And when those things swell up, you find yourself making that horrible, like you can't get air into it. And it's not mucus, mucus will come, but they're swollen up there and you can't breathe anything. But if you can do this and, just kind of flare your nostrils and then breathe in, then a nasal strip could do wonders for you. So I recommend nasal strip. Now, if somebody has some form of sleep apneic event, I'm saying, okay, first do that. But if not, if you want to experiment during the day with mouth tape, just to see if you can tolerate it. But once that sinuses starts to close you up, and you can't breathe, mouth tape should be weak enough to where you can just open up and it just pops off, right? So I like mouth taping as a way to train the brain and the body to continuously start breathing in air through the nose so we can get that oxygen and carbon dioxide exchange evenly so we're not stressing out the body that way. A lot of times when we are sleeping, we need to understand that when you're sleeping with our mouth open and snoring, that's where you hear that, because there's that little part in the back of your throat that keeps, just vibrating. But as we go into deep sleep and REM sleep, our jaw, if it's open, completely relaxes and starts to push on that windpipe. And when that happens, this is when you have your first apnea event. It's a sleep restrictive kind of a feeling, right? Air restrictive flow, and it'll wake you up. or you'll might even have, more CO2 building up. So you wake up and you don't know why. So that's why when you are sleeping, try your best to keep this nasal passage open, sleep in a position where you're not going to sleep with your mouth open. Because, I mean, other than that, I mean, you can become significantly dehydrated with just breathing through your mouth, just like dogs. They will,
Mm-hmm.
breathe through their mouths and really, lose a lot of fluid because they're trying to cool down. Humans do the same thing, except we lose more water and, we wake up with headaches or, something going on. So I always say if you're like in a mild case, sleep tape, totally cool.
Yeah, I've tried the nasal strips and they did work, but I found like irritated the skin on my nose quite a bit. So the
Oh,
glue,
really?
whatever the glue was, but it was like probably not the best quality, and I probably need to look into them a little bit further. But the mouth tape, I don't know, that's a little claustrophobic ishness
Yeah.
for me. I don't know if I could pull that one off, but Brendan,
Too Orwellian for you?
Brendan,
Definitely
have
don't
you
do
tried
duct
these
tape.
things or what
Yeah.
have you tried?
I really don't have, fortunately, I really don't have sleep issues.
Oh,
But I do
forget
come
this
across a
guy.
ton
Get
of
out of
people.
here,
Yeah,
Brandon.
forget
Just
why
get
is
out of
he?
here, man.
I'm the
Come on.
anomaly.
You invited this guy.
Yeah, we can't relate to you.
Only where they get stressed out about doing certain interviews, I suppose. But no, I don't really have issues. But I will say that when magnesium's low, that will kind of prevent me from going to sleep at the right time at night, for sure.
Mhm.
Um, and I hear from a lot of folks who, generally speaking, when they run into a health food store, they will immediately go to the melatonin. That's like a go-to for them.
Hmm.
Oh, okay, it's holistic.
Yeah.
It's all good for you. So they'll do that, and that will work for like maybe 3 or 4 weeks for them, and then it won't work. I don't know
Mhm.
exactly what's going on there. I don't know if like has that been something that you've experienced too? What do you think's taking place from biochemically?
I mean, like when you're starting to substitute certain things, I'll have pharmacist friends that say, well, like, don't take until you test, right? Because I mean, what's the whole
Right.
point of getting on melatonin if your melatonin levels are already fine? I mean, it will help
Right.
having more melatonin. You might feel, sedated, but if you're not fixing the underlying cause of why you can't sleep, well, the underlying cause will always disrupt your sleep regardless, right?
Yeah.
You have to find, and that's why there's so many questions when you talk to me is we're looking at every aspect. And a lot of times I'll just have a 3 or 4 page sheet of red flags and go, all right, where do you want to start? Where do you feel confident in starting? Because if I start telling you to do this, this, and this, I don't want to burn somebody out just by getting better, So that's why a lot of times these sleep things can take a long time, or I mean, you just can't think of it as a quick fix. It's a journey, and if you can't enjoy the journey, man, it's going to be much harder, So I always say like there's an underlying cause, and it's just like putting a band-aid on a wound that keeps festering. If you don't target that cause of why that wound is continues to fester, you're just going to need a bigger band-aid, or that band-aid just stops working.
Yep, that makes perfect sense. And you've talked about mechanical, you talked about biochemical approaches. Are there any, and I know you're like the expert when it comes to holistically taking care of these things. Are there any holistic things that we haven't discussed that we could bring up?
Yeah, I think a lot of what we do as we get older is we become more insulin resistant, metabolic unhealthy. We relax a little
Mm.
bit. Maybe we lose some energy because our hormones are starting to fluctuate. And I always say this for men and women: when your hormones start to fluctuate, make sure you have somebody that is monitoring those. Because for men, once our testosterone starts to dip,
Hmm.
I've had many doctors tell me, you might as well put one foot in the grave, you know?
Yeah, yeah.
And because your metabolic just completely changes, you start to eat more, you start to gain more weight, you don't work out as much, you lose muscle. And all of those are extremely important. And all of those put stress on our bodies. And I feel like if you don't address stress, the HPA axis stimulation from either inflammatory diseases, chronic illnesses, the bad habits that we do that make more stress, I always say it's going to be harder to find that time to go to bed or stay asleep. I know a lot of people that are so stressed that once they hit the pillow, they're like, man, I'm out. But then I wake up 4 hours and I'm like, yeah, that's what That's what
Right.
cortisol and burnout and all of that can do. It just throws you off, you know? But when they wake up to go to work, they are completely drained. They don't have that cortisol awakening response that gets them out of bed. It's
Right.
much more shunted, you know? So if you're not looking at your metabolic health, things have a way of just compacting and just, just getting bigger, snowballing, you know?
Yeah.
And so that's why if I see a certain type of clientele, I'll ask them just straight up, I go, how fast are you actually looking to start sleeping better? Because I've worked miracles before. I'm not going to lie. I'm good at it. But you have to understand that this is going to be a journey and you need to get in the right mindset, first of all. And number two, you need to be in the right mindset to just overall get healthier. And a lot of times we hit on that metabolic, we hit on diet, we hit on exercise, we hit on movement, we hit on, even lymphatic massage, if they have a sauna. I mean, we try to do
Right.
everything to flush the body because we all know our environment is full of crap
Hmm.
and it can accumulate in the fat. And a lot of times when I'm dealing with somebody that may be obese, I try to warn them if you start to lose weight too fast, those toxins, those anything that's lodged into your fat cells break down and they're released in your body. So you could feel slummy, you can have headaches, you can have nausea, you can feel really bad, which is normal because we're loosening these things up. But we need a way to kind of go around it as well. And that's where that education piece comes in.
Yeah, the Herxheimer effect. Lovely.
Yeah. So one of the things I know you mentioned when we were talking to you early on is the four pillars of sleep health.
Yeah.
Explain to me what that is for people that are watching this. What's each pillar and
Yeah.
what does it mean?
So over time, I've just I target my questions when I talk to people about their sleep issues into four categories, and I just call them my pillars. Obviously, people can have five or six or eight or whatever, but just to simplify it for them when I'm coaching them, teaching them, because the one thing that I really want to do is coach somebody that's going to pay me to do this, right? And I don't want it to be me teaching them or telling them what to do. I want this to sink in so they can troubleshoot it for themselves in the future. I want them to be able to be their own sleep therapist when they're out on the road and it's like, oh, I didn't sleep very well. It's because of this. Next time I need to do that. So when it comes to the four pillars, I'm looking at how do we optimize sleep pressure? I feel like that's nature's sedative. It's a chemical that we produce when we lift weight, adenosine or adenosine. Anytime you produce ATP and you use it, byproduct adenosine. Adenosine has adenosine receptors, causes you to feel drowsy, causes you to feel sleepy. Caffeine blocks it. So I always say, watch your caffeine roll. So that's all optimized in that sleep pressure category. That's one. Number two is how do we strengthen your circadian rhythm? How do we align it to the schedule that you want, whether you're traveling, whether you're jet lagged, whether you're socially jet lagged? How do I put it to what you can thrive in, basically? So if you're a night owl and you're okay with that and work's okay with that, let's just be a night owl, right? And then support it. But if you can't be your night owl because work is 9 to 5, well, guess what? We're going to have to do some habits that anchor and strengthen that circadian rhythm to where your schedule needs to be. And then the last two deal with the stress. So you have physical stressors and then you have mental stressors. We hear mental stressors as emotional stressors, things from work, a lot of precipitating factors. But stressors can also be certain behaviors that you've adopted over the years, like being a perfectionist. If you talk to any pharmacist, the majority of pharmacists have to be perfect in their job. You make a prescription error, you can sometimes, really harm somebody.
Hmm.
So when you work with healthcare professionals that have to be perfect, they sometimes take that same mentality and bring it over to something like solving their sleep. And when it doesn't come that way, they become frustrated, stressed, anxious. And that's something that they need to be told. We can't carry that over to something that deserves our relaxation, our calmness, right? So those can be mental stressors. And then as we look at physical stressors, I'm looking at how are your blood sugars? Because when those start to go erratic and you get peaks and drops, right? Those are going to cause a cortisol response. What kind of chronic illnesses are we dealing with? Chronic sinusitis can cause these types of HPA responses. Any type of inflammatory conditions, joint conditions, um, gut issues like dysbiosis, the leaky gut. So I don't have the access to diagnose that, but if I see certain trends that can lead to that, number one, lack of sleep can really disrupt the gut barrier. And then you combine that with seed oils and other things in your diet. Well, now I have a potential, like this is what could be happening. This is going to be your next step is to see somebody that can run these gut tests for you, right? And be more specialized. So it's really those four. You got optimizing sleep pressure, how to anchor or strengthen your circadian rhythm, mental stressors, how to identify those and deal with those and cope with those, and just train yourself to just kind of be mentally more calm and more resistant. And then those physical stressors, what can really impact on the physical side to impact that mental side, because a lot of times we only think about mental stress stressing us out, but you could be eating all these foods that's causing these blood sugar irregularities and then find yourself more stressed, more anxious, and not knowing why you're freaking out about small things. So it's so holistic, and that's one thing that we just have to just kind of keep our eye on the target, is that it's not just one thing a lot of the times. I just can't give you a recommendation based on one question that's going to solve it. There's
Mm.
so much more that has to go into it.
I love that, teaching somebody how to fish as opposed to handing them the fish so that they can figure it out later. And this is complicated.
That's it.
It's not that
Mhm.
simple because, because we've sort of destroyed and disrupted the environment that we live in. I think it's great. This is like a 360 approach to sleep. So I think it's awesome. Well, one of the things I did want to bring up, because you're speaking my language when you talk about gut health and HPA access dysfunction, and that's I talk about that quite a bit. That and seed oils and all that stuff. But you mentioned specifically, you said something that negatively impacts HPA access that might cause that dysfunction that I haven't heard of before. Could you sort of expand on that for a second?
Yeah, one thing that I've been looking at is what can stress the body, right? And let's just say if you're not getting enough sleep, less than 7.5 or 6.5 hours, right? We can easily put you in a sleep deprived state by not getting the amount of sleep that you should, right?
Mm-hmm.
It's been shown that being sleep deprived one night or many nights, there's obviously various degrees. If I get 2 hours of sleep, my sympathetic nervous system is going to be ramped up. And what happens?
Right.
Your HPA axis gets stimulated, cortisol, inflammation, all your norepinephrine and things like that. They all flood your system throughout the day, right?
Mm-hmm.
And one thing that we see a lot of the times is when the HPA axis is on constant go. And I think, and I would have to look this up, but cortisol releasing factor has the ability to disrupt mast cells or certain cells in the intestines that really loosen up that lining, right? To make you more susceptible. And a lot of people are like, well, don't we want that? Like, don't we want our intestines to like absorb everything that we eat? And I was like, yeah, I mean, we do.
Sure.
Unfortunately, our food is not clean like it should. And there's sometimes pesticides, other
Right.
bacteria. There's LPSs that are just floating in our gut. And the moment they
Yes.
go into the bloodstream, now we get that immune response, right? Now we're putting more stress on the body. And so, it's sleep can do wonders for gut health. It's not the end all be all cure because, like you said, in lifestyle, we can eat seed oils, we can eat foods with a lot of sugar that really disrupt that barrier and cause the gates to be open for anybody. But we
Right.
just want that selected, nutrients that we get from nutrient dense foods.
Yeah, that makes perfect sense to me. Jason, you got anything else?
Yeah, I got a lot of stuff.
Go right
Um,
ahead.
so one of the things I wanted to tie into sleep that a lot of people don't immediately recognize is that there is a direct correlation. There's some studies done that shows a correlation between immune strength and quality of sleep. And there was a recent study published, I think, in 2016 that showed that if you got less than 7 hours of sleep, that your risk for getting a upper respiratory illness increased by almost fourfold. And I think it's interesting how sleep can be an extremely powerful way to heal the body, right? And when we deprive our bodies of sleep, it's like basically we're working against our body's healing process. So I always found that very interesting when people are getting sick and I'm seeing patients on my own. I always ask them, tell me about your sleep quality, tell me about your sleep habits, not as deep dive as you do, but generally I'm trying to understand or engage, how many hours of sleep are you getting? Um, for me, like, I probably don't get enough sleep. Maybe, I average just under 8 hours, maybe 7 hours on average.
I'll take
Um,
that.
take that. Okay. Sometimes less, but I just found it interesting in this study that it showed almost a direct correlation with sleep and the number of colds that you're going to get in a given year.
Yeah, I mean, I think I've heard a lot of studies about that, especially, one night of sleep deprivation. Like, I think they did it on 4 hours or less. Like, the natural killer cells in your immune system, which are responsible for targeting antigens or viral
Mhm.
components or something like that, they attack, kill, and you're done, right? But those have been significantly reduced from a night of sleep deprivation. They've also done studies where I'm not a big vaccine component, but it was on vaccines, and they said that if you get a good night rest the day before you get a flu shot, you have a better response to building antibodies. So, kind of showing that your arsenal is fully stacked is really cool. That just happens with sleep. So I think that's something that keeps getting repeated whenever I see those studies. They're like, "Hey, did you know sleep and your immune system?" And I'm like, well, what's the mechanism this time?" And I was like, "Oh, same thing that I've been reading." Or I'll see it and I go, "That's a new mechanism. That's pretty cool. Let's put that in the memory bank." So it's constant. It's your foundation. I feel if you're not getting sleep, everything else is going to kind of be a shaky foundation and almost crumble.
Do you feel that people's sleep habits have gotten worse over the years or stayed the same? Because I've heard data in different directions. What are your thoughts on that?
Yeah, I felt like since the intervention of like the light bulb and the TV, I feel like that's where it started because I could remember my dad just watching TV, just trying to like be exhausted enough to just fall asleep on the couch, right?
Hmm.
But guess what? I mean, more things have come into our lives since then. I mean, we don't just have TV anymore. We have our phones. We have literally the world inside of our hand at any time we want. If you're like so many people have told me, they're like, if I'm in bed and I think of something, I'm gonna find the answer. And I'm just like, okay, I can see where the issue could be here. Um, but you get that blue bright light right there, shut down melatonin, right? So, you're done. And not to make matters worse, these phones are not designed to be your friend and they're designed to be a tool and we have to be in control of that tool. But if you're on social media or you're on Google, you have to remember they want you to stay on these apps. They want you to
Yeah.
stay on these sites. There's an algorithm that looks for things that you click on so you can click through the next news story. So you can click on the next. So if you allow the tool to run you, then you're never, going to be in charge, right? So I
Hmm.
always say since the invention of the smartphone and how they are just so captivating for us. I do feel like our sleep has just worsened. And a lot of us, it's as simple as taking a detox from social media or, TV or whatever it is that you're addicted to. But I mean, we all know it. We work to grind. Most of us, we get up every day, um, trying to push every limit, trying to burn the candles at both ends, not knowing it. We're working on this crazy project, and then we come home, we're with the kids, and then at night we're working some more,
Yep.
and there's really no relaxation, no calmness, and we kind of need that throughout the day. And I think a lot of us just don't understand like breaks are important. Vacation is important. Purpose other than work is important. And the more we start to incorporate that, the more we'll start to realize like, oh, I can actually stay away from my work. I can, level set and just kind of be more in that parasympathetic stage of rest and digest, which your body will thank you when it comes to longevity.
All right,
Well said.
I got a quick
Good.
question for you then. Hold on. So, based upon that, and I know you've had sleep issues in the past, right? So, what does Dr. Zeke do? What's his formula after, say, 6 o'clock at night? What to make sure that you get a good
Yeah.
restful
So
night's sleep? What does that
That's what
thing look
people are
like?
paying for. Come on.
Yeah, yeah.
What does the expert do?
Yeah. So my bedtime's at 10 o'clock. Lights out. There's nobody. Like if my wife comes to me, she's like, I have an urgent whatever. And I go, does it have to be right now at this exact moment? If the answer is no, I'll take care of it at 8 o'clock. Don't even tell me. All right. But usually around 7 o'clock, dinner's done. The lights, as soon as the sun starts to set, I either have some kind of blue blocking glasses on. I will dim my light. So in my house, I have two types of lights. I have primary bright lights for the day, and then I have lamps with lower lux of light. So I'll turn off the bright light and I'll have the secondary lights on, is what I call them. And with that, it's really allowing the light exposure to start decreasing. So I can naturally just allow melatonin to slowly increase, right? I also have my glasses on. And this is about the time where I'm done with dinner. So I'm either doing some kind of activity where I'm walking my dog, I'm spending time with my kids reading books because they go to bed around 8 o'clock. And then after that, I'm cleaning up. So my body's moving. I'm doing things. Sometimes my kids and I will just play some board games and just kind of be active, really trying to put the household in a more relaxing state. But once my kids are going to bed, I'll do some reading, something that really just mellows me out, something that I wanted to do. And then 1 hour before bedtime, that's typically when I'm ready. I am getting ready. Warm shower. I'm trying to cool down my body the best that I can. I'm trying to allow all the heat in my core to release. So I'm thinking of my hands because that's how our heat is eliminated through our bodies. So if I have cold hands, cold feet, I'm warming those things up because I need my body to start dropping. At this environment for my power down, turning down my AC. At this point, very little light. I probably have my twilight glasses, so these go from yellow to a little bit more red amber. So I'm really eliminating any type of white light that can disrupt me. And then with that, I'm starting to do more of my gratitude at this point. I am lucky to have a PEMF mat, and my PEMF mat has a certain setting. It's around 3 hertz. So if you do have a PEMF mat, 3 hertz is usually the synchronization to help with deep sleep. And I'm laying on that and putting down my thoughts in my head. What do I feel grateful for? Because when I feel like I'm going to bed happy, I'm more uplifted. Those nights where I wake up in the middle of the night, I'm not angry. I'm cool. I'm chill. Like it just doesn't bother me anymore. I got so many other things to be grateful for. I go to bed, right? So I'm doing this practice, and then usually around 15 minutes before my bedtime, I'm usually 9:45. I'll go lay down and I'll just start practicing some deep belly breathing. I mean, just like where you breathe in and you slowly exhale. Sometimes I'll do some humming because your vocal cords, you have your parasympathetic nerve that comes out through your cavity right here, and it goes right by your vocal. And sometimes I like to hum, and my wife walks by and she's like, "Oh my God, like, what are you doing?" But it's usually on times where like I'm excited, I'm happy, and I can't like get myself out. So I'll kind of do this kind of humming, and it will really just kind of, really put me in more sedated form. And usually when I start yawning, I'm just like laying in bed and I'm not thinking about sleep. I'm not thinking like, am I asleep yet? I'm thinking about how do I get comfortable? How do I feel so good that I don't care. I just let whatever happens, happens, right? Because that's one of the things that we do wrong is we want to go to sleep. But really, you should just think about how can you feel safe? How can you feel relaxed? How can you feel calm? How can you just let the sleep come? And you just keep doing what you're doing where you're just continuing to yawn. And before you know it, like you wake up and you're like, wow, that was awesome. So my bedtime routine, it typically starts 3 hours before bed when I'm starting to notice things, starting to realize what I need to do to start getting my body sync And that's just me. I don't need it every time. I mean, I go out with my wife and I'll come back and do like a 15, 20-minute power down. We're done, you know? But when I can get into my zone and when I'm at home and I can control everything, that's what I like to do. My day starts right after dinner, you know?
Wow, that's a lot of stuff. I was just anticipating a couple of things. That was a lot.
Dude,
You
I just
know,
gave you the recipe book, man.
dude,
I know.
Dr. Zeke, you had me the whole way up
I fell
until
asleep during it, as a matter of fact. It's
well,
crazy.
I
You
was
just
there up until the
put that
point where he
snippet from your
told his wife no. I want to hear more about how you tell your wife no and get away with that.
Oh,
That's
yeah, good luck.
podcast on
Yeah.
this because like I can't do that, but
Yeah.
that's impressive. It's impressive that you tell her no and she just goes away.
Hey,
Like,
a
no, we're
quick
not
question.
talking about this. I'm in my sweet power down theta wave mat
For
sleep.
you had mentioned something that I don't know if all of our viewers are aware of, the PEMF mat. So is that to neutralize EMFs, or could you explain that a little bit?
Yeah, so it does a few things, right? So PMF stands for pulse electromagnetic frequency. And when you look at pulse magnetic frequency, it is not the same as EMF because when you look at electromagnetic frequency, you're looking at such a high frequency. I mean, when you think about 5G, the frequencies there are so high that they have the ability, I will say, to disrupt bodily function, bodily biochemistry.
Right.
Most people point to what we call the electron transport chain when producing ATP in our mitochondria. And so when we think about that, there's also things like radio waves, microwaves, literally all of our electronics, right? So what I've started to use is called a PMF mat. Now, my mat is by Therasage. I love their products because what they normally try to do is provide you with multiple mechanisms for your health. And one of the things that's kind of cool is that along with PMF, they have 9 different settings. So there's a setting for relaxation, which is the 3 hertz deep sleep. You have the 8 hertz setting, which is very synchronizing to the Earth's frequency. So if you wanted to ground, same frequency as what you're getting from the Earth, then it has infrared heat. And why I like infrared heat is because infrared heat can penetrate through the cells and start breaking things up. Also heats up your body if you need it. And then they also have these grounding gemstones, right? So we know that the Earth has free electrons. Certain gemstones like black tourmaline, jade, quartz, amethyst, they can release these free electrons as if you were laying on the Earth, right? So PMF is just one modality that I just started incorporating during my wind down. It's also just a great thing to just use during the day because I'll be in a slump around 12:30, 1 o'clock, sometime after lunch, and I'm going into a meeting and I have to be like ready to fire off, right? And I'll put it on like a setting of 25 to 40 hertz. And what they've kind of done is their research on what hertz, what type of frequency to start stimulating more energy production, more creativity. And it's
Right.
just something that I've just been able to use where typically I'd probably go into my kitchen and chuck down some coffee and be like, all right, I got to really pump myself up for this. But really, like this simple mat, very non-invasive. You lay on it. It has red light as well. So you get multiple things at once.
Oh,
And
that's
you
excellent.
come out and you're ready to go. And so it's been my cheat code for a lot of things. So
Yeah.
I've been loving this thing.
The red light, that's a good one, especially for folks up in the north during the winter when they're not
Yeah.
getting enough sunlight and their vitamin D levels are low. That's awesome. You know what?
Yeah.
I think we should put that a link in the show notes on that. I think
Yeah.
that's what we'll go ahead and do because that's a great
Yeah.
suggestion for folks.
Yeah, I would also say for people up in Alaska, think about getting yourself a light box because typically you need about 10,000 lux of light, and there's always times where you're just going to get very little light. And if you're trying to anchor your circadian rhythm, you might need that light box when you wake up, a little bit throughout the day, and then of course, kind of around 5 and 6 o'clock. And then once you think sunset is typically setting, you can get rid of the light box and start, winding down that way.
Yeah, that's a great idea. I live up here in New Hampshire and I have one and I'd highly recommend it to folks. Or you could move down to Florida like Dr. Jason and not have to worry about light box.
No, we got Lux going all the time down here.
Yeah, natural and it's always going. That's true.
That's it, man. Best way to get your vitamin D in Florida.
Or Texas.
Yeah. Now, I like the sand and ocean, so I think you got me there.
Yeah. Well, we get, except during hurricane season.
Yeah.
It's sand and ocean in your home. So I wanted to kind of segue into the Thera Optimal Health program. Tell me a little bit about that and how you got involved in it and what you're doing with that group.
Yeah, recently, working with Robbie Bresner, he is the actual founder of Therasox, that I was telling you about. And I met up with him in a conference and we were starting to talk about how he is pulling together professionals and experts from all over the holistic industry, whether it becomes, somebody in gut health, whether it's somebody with sleep, motivational coaches. I mean, the people in the caliber that I'm working with is just off the charts. It almost seems like, wow, what do you want me here for? But my piece is sleep, right? My piece is education and, how do I get people the education that they need to start making that? So we have currently right now, 2 different programs. We have a foundation program where you're learning from all of these. There's like 82 videos. You just take it at your own speed. And we have a membership. Coolest thing I love about this is that we have a 5-star French chef that is just phenomenal at just teaching you how to be a chef, because I know food is medicine, food is important, but what is one of the most terrifying things when it comes to cooking? It's going to suck, or I'm not going to do it right, or this or that. And as he's just talking to you, he's like, hey, you got these ingredients. We're going to have this as a base. This is and he just kind of separates it into where it just makes more sense and it's easier to cook. In addition to that, we have a master breathwork course where this guy is going and giving you, there's just a database in their membership file where you can just do, a breathwork class. He has music for you to follow along so you know how long to hold your breath, how to exhale, how to do things, really teaching you how to just carry this over, or if you have it in your app, so you just grab it, right? So really focusing on holistic health. As you've been hearing me talk, I've talked about knowing the things in sleep is important. You have those physical stressors that have to be addressed. And if they're not addressed, you're not addressing the underlying cause. And what do we know? Stress management, how to build habits, how to eat nutritious, how to protect our gut, cell health, hydration, and then how to cook all this stuff. And it just gives you all of that. So I've been super excited, super proud of what they've been able to do there. And it's only going to get better. It's only going to grow. So they're having a special, probably until this next month. It's the Founders Bundle. It's like $397. You get the course, you get 1 year of the membership, which is like $30 a month. And it is jam-packed with so many things. And we're just looking for feedback, and we're just, until that price goes up. So you can really just kind of see it, and it's really awesome. So I've been really excited to be a part of that.
I got to be honest with you. This has been an awesome podcast. I mean, you have really brought a lot of information, and I guarantee the viewers that got a lot out of this. And if you are just one part of what that group does, I think that getting a membership is definitely makes a whole lot of sense. We got to do a part 2, though. You got to come back.
Yeah,
absolutely.
For sure.
I appreciate this, man. I appreciate your compliment. It means a lot to me as we kind of navigate healthcare. It's a journey, and I don't know everything, but I do love learning, and that's what we're here for. If you meet anybody that tells you they know everything, just run.
Right. I totally agree with that. Yep, absolutely. Well, listen, we're going to have all of Dr. Zeke's information in the show notes. So Well, I should ask, how can they find you if they want to follow up with you after this?
Yeah. So if you follow Dr. Jason Dubois over at Hybrid Remedies, you can see under his follows, and who he follows is Dr. Zeke Sleep with dots in between, Dr. Zeke.sleep. And yeah, if you have any questions, anything you want to hear, I do a lot of reels for my audience. I mean, everything that I do is for them. I know it's not the cheapest to hire a coach, but I am very much personable person. I'll talk to you. I'll email you back or IM you, and sometimes just make a reel about it and let you share it with your audience. So find me on Instagram. I'd love to connect.
Awesome. I would agree with you.
Awesome.
You are definitely very personable. No doubt
Yep.
about that.
Thank
Jason,
you.
nice job. This has been the Brendan G Podcast. If you enjoyed this, like it, and we'll see you in the next podcast. Thanks very much.